All right. Hello, everyone, and welcome to the Babies in Common videocast and podcast.
Hello.
Hi.
I'm Jeanette Messit-Frem, the owner of Babies in Common. I'm an internationally board-certified lactation consultant, childbirth educator, mostly retired birth doula, and mother of 2 teenagers.
I am Melissa Ann Dubois, and I'm a registered nurse, childbirth educator, and lactation counselor. I've worked in all sorts of hospital and office-based OBGYN settings, and I'm currently providing postpartum home visits for home birth families and accepting clients as a birth doula. I'm also the mother of 3 small children.
Awesome. So we have another great episode for you today, but before we get started, a couple reminders. First, as always, anything that us, our guests, or participants say during this conversation should not be taken as medical advice. Please consult your own qualified healthcare professional for questions about you or your baby's health. Also, the opinions expressed during this conversation are personal to the host, guests, and any participants and do not ever represent the views or policies of any current or former employer, including hospitals and clinicians. Our conversations are recorded on a HIPAA-compliant platform, and for a full review of our disclaimer, please visit babiesincommon.com/disclaimer.
Excellent. Thank you. Now on to our show. Today is May 20th, 2020. And today we'll be discussing pregnancy and parenting after 40. We are joined by 2 very awesome guests today. First, we have Jennifer Shark. Jen received a master's in nurse midwifery from Columbia University in 2007 and practiced full scope midwifery, including catching babies, for 10 years. In 2017, she stepped down from inpatient care and has been working as an office-based midwife for a university health center and has a special interest in pelvic pain and pelvic floor rehabilitation. In fact, she will be returning to the Babies in Common podcast/videocast in the near future to discuss her passion for pelvic floor health. And in the meantime, you can read her blog and check out her excellent YouTube videos on pelvic floor health by visiting sharkinfestedh2o.com. Pretty much the coolest last name ever, Shark. But today we're going to be focusing on her personal experience with pregnancy and parenting, as she gave birth to her one and only biological son in 2015. She also has a teenage stepdaughter that she affectionately calls her bonus daughter, which I think is super sweet. And so thank you so much for joining us today, Jen.
I'm so happy to be here. I'm really excited to chat with you all.
Hey.
And our second guest is Stephanie Lee Butler. Stephanie holds a bachelor's in psychology and sociology from the University of Vermont and a bachelor's of science in nursing from Mass College of Pharmacy and Health Sciences. She also holds a certificate in home birth midwifery from the Massachusetts Midwifery Alliance, but is currently accepting clients as a birth doula and is also studying to become an IBCLC. You can find out more about Stephanie at Sweet Little Bundles Birth Services on Facebook. At the age of 28, she gave birth to her son, who's now 13, and then 12 years later, she gave birth to her daughter, who's now 2, at the age of 40.
As far as pregnancy and parenting after 40, according to the 2018 U.S. birth rate report from the CDC, provisional birth rates declined for women aged 15 to 34 from 2017 to 2018, but rose for women aged 35 to 44. The provisional birth rate for women aged 40 to 44 in 2018 was up 2% from 2017, and the rate for this age group has generally risen since 1982 by 3% per year. So what we know is that people in their 40s are having babies. And a funny side story, I took care of a couple that had their first baby when I was working in Cambridge, which is actually how I met Jenn Shark. And they took my childbirth class for their first baby. And then a few years later, I got an email from them with a beautiful picture of their family and their now 3-year-old son. And she said, we're pregnant again, and we're still in the Cambridge area. The hospital that we had our first baby at, that you worked at, do they accept women that are over 35? I laughed out loud when I read it because, and I said, I wrote back, I'm like, well, what do you mean? Are you having a complicated pregnancy, whatnot? She said, oh, no, I just know that it's advanced maternal age and it's very high risk. And I joked back to her, I said, this particular hospital that Jen and I worked at, I feel like has the highest concentration of birthing people that are 40 and above out of any hospital in Massachusetts. Like,
Very, very likely.
Yeah, and 35 is like, you're a spring chicken. I mean,
yeah, if you're under 35, it's like, what is this?
Yeah,
very different.
So people in their 40s are having babies, and it's not super rare, So Jen, if you wouldn't mind, as a midwife and a healthcare provider, can you speak a little bit about the medical considerations for people who are planning a pregnancy in their 40s, as far as fertility and stuff like that?
Yeah, definitely. So I think the most important factor in planning a pregnancy in your 40s is your general health to begin with. Um, one of the main reasons why pregnancy over 40 can become risky is because many people over the age of 40 already have pre-existing health conditions. So they may be pre-diabetic or diabetic. They may have high or high-ish blood pressure. All the things that can start to change as we age. Those are the things that are going to make a pregnancy more risky in general. If you are, healthy, have no comorbid conditions, so you don't have any major health problems, you eat well, you're reasonably fit, you are probably going to have a normal pregnancy. Some of the differences that are less controllable are higher risk of chromosomal abnormalities. So the one that most people think of is Down syndrome. And when you get pregnant at 35, your risk of having a baby with Down syndrome is approximately 1 in 150. When you're 40, it goes all the way up to about 1 in 80. So that's where it really kind of the curve just goes up really steeply. But still, 1 in 80 is only a little bit more than 1%. We do a lot of things in life that have a greater than 1.5% risk. So, it's still a really high likelihood that your baby is going to have normal chromosomes. But that also depends on your individual fertility as well, and that's harder to tease out, because some people are fertile well into their 40s, like I was, and some people are like, they're really never fertile, and we don't know why. And so when people are planning a pregnancy over the age of 40, we offer them the ability to go straight to a reproductive endocrinologist, just because there is a greater chance that fertility will be a problem. But in my experience, most people want to try to get pregnant naturally first before all this intervention, and a good chunk of them do. So, I typically tell people, don't wait more than 6 months if you're actively like cycle tracking and you're ovulating and all of these things. But if you take that 6 months if you want it. But you also have this option here. So really, I think the biggest thing is, are you healthy to begin with? And that is something that you really have to think about. Is your weight normal? Are your blood sugars normal? Do you have thyroid issues? Do you have any family history of, preeclampsia, high blood pressure, diabetes, all of these things which can impact a pregnancy? And so if all of those things are normal and you are healthy, then you are probably gonna have a normal, healthy pregnancy.
Which takes you into the question of, so what about when you're actually pregnant and you're 40 and people are saying, oh, you're so high risk? What are the risk factors? I know there's people who are healthy and have a fine experience, but what are the actual facts? What happens? Why do some providers make people feel like they're going to be so at risk? And is it still true that if you're having your fourth baby and you're 49, is that really risky because you're 49, or is it more risky if that's your first baby?
It's okay. So let me unpack a few of those things. So being pregnant over 40 definitely does have some increased risk, particularly for gestational hypertension, preeclampsia, and gestational diabetes. These are more common just because people, especially who are eating more of a standard American diet, are already probably somewhat insulin resistant. And then pregnancy itself is an insulin resistant state. And so even if you're not diabetic or even pre-diabetic, you can still be somewhat insulin resistant and not know it, because your blood sugar actually doesn't tend to start to rise until you've been insulin resistant for many, many years. So that really can increase your risk of developing gestational diabetes. And gestational diabetes is not something to kind of be like, oh, that's no big deal, which I often hear. I was like, is it really a big deal? And it really is a big deal, because that then puts you at risk for a number of things like high blood pressure, preeclampsia, having if you can't control your blood sugar, having a baby that is too big to give birth to. And babies who are born hyperglycemic have a real risk of hypoglycemia, where their blood sugar crashes after the cord is cut, and that can lead to seizures. So that's like, this is a whole big thing to unpack, right? Then, our blood vessels are not as elastic as we age. And so that puts us at increased risk of hypertension, of high blood pressure. And if you have high blood pressure during pregnancy, you're at greater risk of preeclampsia. And preeclampsia, we think, the kind of leading theory right now, the cause of preeclampsia is on the way the placenta implants into the uterus at the beginning of pregnancy. And that has to do with your vascular, it's how the two vascular systems interact. And when you're older, your vascular system is just not as flexible, and you're more likely to have, kind of an imperfect, what we call imperfect placentation, right? So we tend to tell people who are in their 40s that they should be taking baby aspirin after 12 weeks to try to prevent preeclampsia. And it does work. It's pretty amazing. You are at greater risk for preterm birth, because if the placenta isn't, really well attached into the uterus, then, you can have placental insufficiency, which, you would show up on growth. And then you might have to have a preterm delivery if your baby is really growth restricted. There's also just an independent risk factor for preterm birth when you're over 40, though that may tie into the number of babies who are born by IVF, because IVF increases the risk of preterm birth. And then the risk of placental insufficiency, placentas tend to stop working as well sooner when you are older. So when you kind of pass that 40-week mark, when you're pregnant, when you're over 40, we are very cautious about the decline in the placental function. And so we typically recommend that if you haven't had your baby by 40 weeks, that you consider being induced at that time, because of the risk of the placental insufficiency. We want to, improve your chance of having a vaginal birth, and placental insufficiency is a common cause of cesarean. So these are kind of the main health risks that we worry about when people are over 40, and why.
Mm.
That's an
Did I
excellent
answer all of them?
rundown.
I think there might have been one other question.
Oh, the other question I think is if somebody is otherwise healthy, right? Is it being like 49 with your fourth baby different than being 49 with your first? Is that what you were saying, Jeanette?
Yep.
Yeah. So, it's risky either way. So in your late 40s, I've just certainly seen people pregnant in their late 40s and early 50s. It really has to do with your vasculature. It's just not the same. And I've seen pregnancy losses, like high blood pressure, like almost universally in your late 40s. I've seen retained placentas, postpartum hemorrhages. In my experience, and this is by no means like any kind of statistical sample, but just kind of my experience of delivering babies for 10 years, I would say that once you get past 45, 46, you just start to see a lot more complications. The early 40s for healthy people tends to be kind of still more normal childbearing years. And whether it's your first baby or your fifth baby, there are risks that are associated with first pregnancies, like preeclampsia. But, so that's slightly increased risk with your first baby versus if it was your fifth baby with the same partner at 45 versus your first baby at 45. But, it's still the further past 40 you get, kind of probably the more likely you are to have complications with your pregnancy, regardless of the number of babies you've had.
You just said something, and I don't remember the reason why you said it, but I remember it was really cool or interesting. When you said with the same partner, there's some difference when it's not a same partner. Can you refresh my memory and share that? Because I remember when I learned it, I was like, that's cool, and now I forgot it.
Yes. So So it seems like, and this is also, obstetrical literature is very, it's a little flighty, but there does appear to be a correlation between having a baby with a new partner and preeclampsia and having your first baby. So there is a possibility that there is some component in the male genetics or the semen or something that puts a person at a slightly increased risk for having preeclampsia or high blood pressure. And we don't really know why it is, and maybe it's an immune response. It's not entirely clear, but if you've had your 3 babies with one partner and you were like healthy pregnancies with those, you could have your 4th pregnancy with a new partner and you would be at increased risk for preeclampsia. And it's has to do with kind of the male genetic component, but we're not really sure why.
Fascinating.
Yep.
Genetics and that,
Very
like, and epigenetics, and
Yeah.
also like the fact that if you carry a male child, there's like male parts of their DNA in your body for the rest of your life. Like, it's crazy. All of that is like so mind blowing to me.
Totally.
I wanted to bring up a point that you touched a little bit on, the term high risk. We do want to take these situations seriously, right? So it is true, well documented, that women in their 40s, or birthing people, pregnant people in their 40s, have an increased risk for possibly developing these things, and therefore should be getting good quality prenatal care that properly screens you for your, gestational diabetes and preeclampsia, and taking that very seriously. And gestational diabetes and preeclampsia, or chronic hypertension, gestational hypertension, these are actually 2 things that we have a lot of statistically based good literature and protocols on, right?
Mm-hmm.
So if somebody does develop those, that is a medical indication for, potentially for an induction or whatnot. But, this term high risk, I'm on this journey. I feel like this professional journey to help pregnant people understand that the term high risk means we have to be high alert that you could develop a complication, but not that I'm going to put a stamp on your uterus that you are high risk and you are definitely going to have these things. And I'll give you an example. I had a patient once who had a history of 2nd trimester losses. Okay, that was why she was in her 20s, but she had 2 15-week losses or something really sad. And so she got a cerclage, which is when they basically sew your cervix shut. Look it up, it's crazy. And so she ends up making it to 37 weeks, and they pulled the cerclage out. And we were having a conversation about labor and birth, and she was, I was monitoring her to see if she was gonna go into labor after I took the cerclage out, and she said something like, well, I'm just so scared of my labor because I'm high risk. And I was like, but you were high risk because you were high risk of having a baby that was born and had a demise. You were high risk because you had 2 15-week losses. You're full term now.
Right.
The reason that you were considered high risk is no more. There's no chance you're going to have this baby at 15 weeks.
Right.
So you're now normal.
So she's not high risk.
So
Well,
so anybody, I just feel like this term high risk is it really should be we need to be high alert to keep our eye out to take good care of you.
Yeah.
But you're not tattooed on your forehead high risk. If you make it to 40 weeks and you're 40 years old and you're otherwise healthy, normal, baby's growing well, and your midwife, for example, and I feel like the practice that you work for is fabulous with this, Jenn, talking about, well, this is why we recommend this. And some people might say, I don't want to be induced. And you're like, okay, well, here's an alternative. We can do Doppler flow studies on an ultrasound, or we can get a deep biophysical profile, or we can, do twice a weekly non-stress tests or whatnot, right? Because it's not people still have the right to make decisions that work best for their own body.
Absolutely. You have autonomy over your body. And if you have a healthcare provider that does not acknowledge that, you need to find a new healthcare provider, because that's super important. And I always, try to counsel people in what the literature looks like, and remind them, that statistics are only statistics. They don't really, when you become the statistic, it doesn't feel like such a statistic anymore, but that it's your your birth, your baby, your body, you're in control. And I think that's very important to, and when I see, other types of practice, it really upsets me a lot. And I agree. I think that that high risk stamp is like, it's just very hard for people not to internalize. And when I actually see people kind of in early pregnancy and, maybe they've had IVF and maybe they've had multiple losses, but finally they're pregnant and they're like, past the first trimester, and they're like, they're just like in this mindset, I'm so high risk, like just trying to normalize the experience for them. And those are actually the people that I really try to steer to make sure they're getting midwifery care during their pregnancy, because they need to normalize their experience because it's been so abnormal up to now. And we in our practice, we are very, we allow people to kind of choose. And when the midwives feel like someone's becoming too high risk for them to take care of, they'd be like, you need to go see the docs. But otherwise, some people they just pick what they're most comfortable with. But I get these people and I'm like gently kind of trying to push them towards the midwives because they need to normalize their experience. And yeah, so I think you bring up a really good point, Melissa, that we just, high risk means different things. And one high risk pregnancy doesn't mean every other pregnancy you're going to have is high risk either. So it's tricky.
Absolutely. Yeah, that's a good point.
Now, like if you're pregnant with triplets, you're a high risk pregnancy, and like there's nothing we can do about that, right? But right.
Exactly.
Even,
let's be honest, your life is high risk at this point. It's a high liability life.
Even after the birth.
Exactly.
Seriously.
But good on you for having 3. Absolutely. Yes.
Definitely.
All right. So, Jenn, was it your plan to have a baby later in life?
Well, yes and no. I kind of always wanted to be a mom, but I never really, hadn't met the right person. And in fact, when I met my current husband, I had already started working on becoming a single mother by choice. I met him when I was about 38. And I had actually even done an insemination at that point by the time I met him, which didn't take, fortunately, I guess. And so once I met him, I was like, well, I really like, I was like, I really like this guy. Like, I should just see where it goes. And just, if I'm meant to have a baby, I will have a baby in the future. And so, once we decided like, okay, we're like, this is it, we're like, let's try to have a baby. And I was 40 years old and a chunk of months. And, we're like, let's pull the goalie. And like the next month I was pregnant. So I was very, very fortunate. I got pregnant the first time I tried. I've never been pregnant before. And had I was, am still a very, very healthy, pretty fit. And I had like a textbook normal pregnancy. In fact, my midwife kind of joked with me that when I was having my son, she was like, is this your first baby? Because I had like such an efficient labor. Like I was like 5 centimeters, 100% +1 before I ever had a labor contraction. And then like I just went boom, boom, boom. And she was like, even your perineum stretched like a multip, So she was like, are you sure this is your first baby? I'm like, yes, I'm absolutely 100% sure. I've never ever been pregnant before, unless I'm missing, like 10 years of my life. And so it wasn't the way I might have envisioned my life when I was 25, but it's the way it ended up happening. And I wanted to have a baby, and I was willing to do it at 40 versus, being like, I'm too old, I'm just not going to do it. Or I'm going to, do it, become a parent through an alternative method. And, I also got very lucky that I met somebody who already had a child. So I did get a bonus child in the mix. And, my 2 kids are 12 years apart, and they're both awesome, and they love each other, and you know, they're both great and terrible at the same time, like all kids. But mostly great, mostly great. We'll say that.
Was your partner, your that then new husband, supportive of doing it all over again? Because, you know, how old was your bonus daughter when you got pregnant with Solomon?
She was 11.
Okay.
And she
So,
was
I mean,
12
that's like
when he was born.
middle school, right? Like no more diapers, no more baby years. So like, you know, did you ever get kind of like pressure from family or be like, oh, but you know, you guys are already past that. Like, you know, sometimes I hear people in their 40s are like, you don't want to be the old parents, you know, like, so did you get anything like that, or was he psyched to do it all again?
Once we made the decision to do it, he was really excited and all in. And we did not get any negative feedback from anyone. And I think partially because my father, who was at the time my only living parent, had been like waiting for a biological grandchild, because my sisters are his stepchildren. And so he was just like totally psyched. Like he was like, whatever, like we were old when we had you. Now they were in their mid 30s when I was born, which then was really old, but now, you know, so he was just kind of rolling with it. And, you know, my husband's family was really excited as well. And given two things. Number one, that I was working in a big midwifery practice at the time. Everybody's very excited whenever anybody's having a baby. And then I live in Cambridge currently, and there are a lot of moms over 40 in Cambridge. In fact, probably at least as many, you know, moms having baby over 40 as under 40 here. So we kind of fit right in. And in fact, my husband was really one of the young parents here. When he moved here, when my stepdaughter was about 6 months old, and he was early 30s. I think he was like 30. He must, let's see, he was 42 and my son was born. So he would have been like 30 with a baby, and that's pretty young in Cambridge. So he's having the kind of the real Cambridge experience now.
Well, that's great, because, you know, you found the perfect community.
Totally. It's true.
Awesome. Well, Stephanie, so there are 12 years between your son and daughter, or 11, I think you said earlier, right?
Like 11 and a half or whatever, yeah.
So were there life factors that led to that age difference? What was happening there?
So definitely life factors. So my son and my daughter have different fathers. I was 27 when I got pregnant with my son. I was 28 when he was born. I dated his father for a little while, and we got pregnant. He's no longer in our life. We occasionally will hear from him. Big deal. It is what it is. So I didn't really date after my son was born for many years. And then here and there I would date people, but then I met Jay, which is my daughter's father, and we just knew that we were going to be together. And even though we're not married, we don't necessarily want to get married, but we talked about having a baby. I'm like, we're both getting kind of old, and we need to think about this because you don't have any children. And I think you do want some. And he did, you know, so we talked about it a little bit back and forth. And then, so I think it was like December, right before I got pregnant with her, which was about maybe May of the year of whatever. So it was like 2017, we started talking, 16 when we started talking about it. And I went to Dr. Klein, and because I had some strange periods that weren't necessarily normal for me. He gave me, I think it was a progesterone thing. I took it for a few days, and then after that my periods went back to regular. So within a couple months I was pregnant. And yeah, I mean, I did not, other than that progesterone that I took from Dr. Klein, I did not have any problems getting pregnant. I did not have any I did not need to get IVF or anything, which is great. So yeah, definitely, didn't think about it necessarily either time, except for the second one. And even then we weren't sure. It's kind of like, if it happens, it happens.
And that's a good point about, like, you know, there are lots of people in their 40s that are fertile that we are talking to right now. And sometimes people just get to a point in their life where they're ready to have a child, and they happen to be 40 and they are struggling with infertility, but it might have been that they had that infertility for a long time, because many people are on birth control pills, you know, in high school. And, you know, I can speak from experience. You know, I went on the pill when I was 17, and I absolutely did not want to be a teenage mom. My mom is a teenage mom, and I saw how hard she had to work. And so I would have taken 17 birth control pills a day to get pregnant. So I was very good about taking my birth control pills from when I was 17 until when I was 27, when my husband and I decided to maybe start trying. And then we had a lot of trouble trying. We tried for a year. We got pregnant, had a miscarriage, thought, well, at least I can get pregnant, right? So kept trying. And, you know, had a second miscarriage a year later, and then saw an infertility specialist, got worked up, was diagnosed with unknown infertility, like female infertility unspecified, and then ended up needing treatment with Clomid to get pregnant, had a third miscarriage, and then finally conceived my son. And so, you know, when I worked as an OBGYN office nurse, I would hear from patients that were in their, you know, maybe later 30s, that were, you know, maybe calling us because it had been 6 months since they start trying, and like, well, the birth control pills were what have caused my infertility, or that's what my mom or my, you know, sister had told me, or, you know, maybe if I had tried sooner, I wouldn't be having these problems. And, you know, maybe if they did try sooner, I mean, certainly there is good evidence to say that, you know, there is some decline in, you know, fertility after the age of 27 and whatnot. But sometimes, you know, infertility is really common. I think it's 1 in 8. Or, you know, couples struggle with infertility. And so, you know, there's this idea that, like, everybody who's in their 40s is infertile and all need IVF. And, you know, nobody in their 20s and 30s could ever possibly be infertile. You're supposed to just be a fertile myrtle. Why aren't you pregnant yet, Melissa? You're 27, you know? And it could just be that, you know, because you were being very careful about not getting pregnant, you never really got a proper diagnosis, you know, of infertility issues until you decided when you were 40 to have children. So just something to kind of keep in mind. I feel like that's kind of a big myth out there.
Yeah, I have a friend who, in fact, had her first babies at 45 through IVF and a donor egg, because she and her husband had been trying for years, and finally found an infertility specialist who kind of looked at her, like, her medical records, and he was like, you were never fertile. Like, she had been on birth control pills for probably 20 years, but you know, he was like, you probably never even needed to take them. And like, her eggs were just never good. And that happens, you know, some people just are never fertile. And so it's when people come looking for fertility counseling, you know, before, you know, even trying to become pregnant, you know, I try to advise, you know, fertility is really individual. And yes, we have statistics, and they do bear looking at, but it is just so highly individual. And there are plenty of women in their late 30s and early 40s getting pregnant spontaneously. And we kind of think that everybody who's pregnant over the age of 35 must have had IVF, but no, most of them probably didn't actually have IVF. IVF is very expensive. And, you know, we're fortunate in Massachusetts that most insurance do cover a certain degree of IVF, but most of the country, people can't get IVF unless they're paying out of pocket, and it's crazy expensive.
Yeah,
absolutely. And the other thing is, you know, that I encountered as an office nurse is that when you start diving into the history, sometimes people have been taking birth control in whatever, that Depo or birth control pills or whatnot, because of horrible, painful periods that were never properly diagnosed as something, for example, like endometriosis, which we absolutely know can affect your infertility.
yes.
I mean, the number of people that I have met in my career that have took years to be properly diagnosed with
Oh, yeah.
endometriosis is overwhelming, right?
That
And
is
so
an entirely, that is
separate,
a
right?
conversation in and of itself. Yeah.
It's so true. It's so true. And so, you know, I just feel like if you're somebody that's older, in like later in life and struggling to get pregnant, sometimes there's a guilt, like if I had just tried sooner, this wouldn't happen. Or sometimes other people say that, like, oh, it's all these, you know, feminist women who just want to put their career before family and kids, that are now they're just trying to get pregnant at 40. And it's like, as you described, sometimes people have been trying for, one of the most memorable births I ever attended was a couple that had tried and tried and tried for 10 years to have a baby, and then had a surprise pregnancy like 3 years after they had decided to just like you know, get dogs and buy a different house and like
That's
stop
awesome.
trying. Like it was, and I think it was just maybe your body was just like, one more chance, and like
Right.
let's
It's
just
the
like
one
throw out
day,
one
don't
more
come
egg,
out.
you know. Like, because like they, you know, the thought of being like, oh, you know, just thinking it's going to be easy trying to get pregnant at 45. It's like, they've been trying for 10 years, you know, like
Yeah.
cut people some slacks. There's a lot of like stigma and myths out there, but you know, a lot of people beat themselves up like maybe I wouldn't be having these troubles if I had tried sooner. But you know, it's not always like that. It's not always just, you know, if you had tried sooner things would be easier.
Right.
There's plenty of infertility issues in younger people as well.
Mm-hmm. Mm-hmm.
Yeah. Melissa?
All right. So as we discussed in your intro, Stephanie, you were 28 when your son was born and 40 when your daughter was born. And while every pregnancy and birth is different, is there anything related to your age specifically that you found was different between being pregnant at 28 and pregnant at 40?
So it's funny that you asked that because I've been thinking about that question. I don't know. And the reason I think I don't know is because I have different sexed children. Because I remember a friend of mine who had a son and then a daughter within a few years of each other, and her pregnancies were totally different. So I'm not certain. With my son, I had a fairly easy pregnancy. I was 27, 28 years old. I didn't really have any problems. With my daughter, the only problem that I feel like I really had was the horrifying hyperemesis that I had, which has probably changed my life in the last 3 years. I feel like it has caused me to have PTSD. And, you know, that's the only real thing that I can think of. I mean, maybe the way I was treated in pregnancy, but the doctor that I saw with my daughter was a different doctor than I saw with my son. And the doctor that I saw with my daughter, he was great. I mean, he did not treat me like I was old, even though I was 39. I was 39. She was born when I was 40. I had just turned 40 about a month before she was born. He didn't treat me necessarily any different. So, I mean, I personally have not experienced too much other than like maybe possibly the sex difference, but I mean, it wasn't crazy other than the fact that, although when I was in labor, that's not true. When I was in labor at the hospital, they treated me like I was like 1,000 years old.
They're like, do you need a walker, Stephanie? Elderly.
So like my doctor didn't think me so bad, but when I was in the hospital, like, all right, lady.
But you were also trying to do a VBAC as well with your daughter.
I was, yeah.
Yeah.
Which did not end up as I hoped. I have lots of reasons why I believe that happened. I honestly think the biggest reason, this is so embarrassing to say, is because I was so constipated. I probably hadn't pooped in like a week. I really believe that's why she didn't come out the right way.
Get an enema.
I swear to God, that's the reason.
So you had 2 cesareans then. You had 2 cesareans. And so do you remember, was there any difference as far as birth and recovery, like having surgery and recovering from surgery physical, mental, emotional between being 28 and 40?
So with my son, I mean, the one of the differences is that I did not know anything with my son, and I knew a lot better with my daughter, and I still allowed what happened to me to happen. But recovery wise, I feel like it was much easier when I was younger, for sure. The pain was much less when I was younger. I also have experienced some things. I don't know if it's because I'm older and it happened or because of something happened during my surgery, but I've had a lot of like residual pain and like bad side effects, maybe from the epidural. I'm not sure what it is. But mentally, definitely a huge difference. I think for me, it might have been dealing with my son, who was already dealing with some issues surrounding her birth. He was supposed to be there and they wouldn't allow him. And then I had a C-section, and then I was in there for 5 days. I couldn't see my son for 5 days. And I think that was probably the most traumatic thing that's ever happened in mine or his life to date.
Why couldn't you see him? They wouldn't allow him to visit?
They wouldn't, because it was flu season, which
Wow.
infuriates me to no end, because I think it's total BS. And they wouldn't allow him in to visit me. I understood if they didn't want him there for the birth, even though I think he should have been there. But they wouldn't even allow him to visit me afterwards. And he was angry with me for so long. It was really hard.
So some of that is, just
and we're
like
still
you're
struggling
saying,
with it, I believe.
the multi-generational, like the fact that you're having another kid and then having like kind of like, the second time mom issues. Certainly that. Do you feel like there's anything that specifically related to, like, and it's hard to tease out because you were a second time mom when you had your second baby, but is there anything specifically related to like your age, or do you feel like if you had your son when you were 40, do you feel like your health, body, whatnot, physical, emotional, would have been the same? Or
I think it probably would have been the same. Yeah, I do, because I was a little bit overweight when I got pregnant with my daughter, but I wasn't like unhealthy. So as far as that goes, like, I feel like I was actually, other than the hyperemesis, I tried to be very healthy during my pregnancy. I ate things that I was supposed to, and when I could actually eat.
It was actually probably good that you started out with a few extra pounds, given you
I know.
Yes,
Oh God.
I did. I lost a bunch. So by the time she was born, I had not gained much more than like 5 or 10 pounds.
Wow.
From my current pre-pregnancy weight, but I was already a little bit overweight to begin with. So my doctor wasn't concerned about it at all. I mean, I don't think that it would have been totally different, but again, I don't know.
So for both of you, but we'll start with Jenn. So parenting as a 40-year-old, there's the stereotype of we're so tired, like, how do you feel like it's been for you?
Well, I am pretty tired, actually. I think, if I had had a baby at 25, I certainly would have had more energy than I have now. There's just no question about it. But I also feel like I have a lot of things now that I definitely did not have when I was 25. I was very depressed in my 20s. I would not have been a good parent. I was not financially stable. All of these things, when I had a baby at a month before my 41st birthday, I had a stable relationship. I had stable mental health for 10 years. I had, a stable career, like all these things that I just did not have in my 20s. And I think that has made me a better parent. I did suffer from very severe postpartum depression and anxiety, which was I don't know why I was surprised by it, because with a history of depression, I was definitely at risk for it, but it's the way it hit me was just unexpected. I'd never kind of expected to experience the kind of symptoms that I had. And I was exhausted because, as I was really committed to exclusively breastfeeding, and My husband had his job at the time was like super high burn, high stress job. And so I was like worried about, well, I want exclusively breastfeed. He can't do that in the middle of the night, so I might as well let him sleep, But then, like I started feeling I had to take on everything. And yes, so that did make me probably way more tired than I had to be. Now at, 5 years later, I think I have a lot more patience. I have a high needs son who just, he just can't entertain himself in any way, shape, or form. Like he really needs that human interaction to be able to focus and do things. And that's one of this coronavirus time has been really, really difficult for him. And I don't know, I would have had the patience for this in my 20s. So, I think that I had I got the child that I got, and I'm glad that I'm the person that I am now with him rather than the person that I was when I was younger. So yes, am I probably more tired than the 25-year-olds? Yeah, I would say for sure. But I also, I have I work full time, and I think when you work full time out of the home, there's a little bit of that guilt that you want to be able to spend more time with your children. And so the time you do spend with your children, you try to like focus it so much. I think that's kind of exhausting too. So sometimes it's about also letting go of this guilt. Like it's okay to work outside of the home and you can still be a good mother that way. And I actually think I'm a better mother for it. And I have seen that now in the COVID-19 experience.
Amen to that.
But, I'm doing my best, but, it's all, it's so much of it's a guessing game. I really do believe I'm a better parent now than I would have been, 15 years ago. But, there could have been so many things that could have been different in my life when I was younger that might have made me a good parent. But in the life that I had, I'm glad I'm a parent now and was not a parent then. Is that an okay answer?
That's an awesome answer. We keep it real on this podcast, and I feel like that is a real answer. Like, it's funny because like I said, we started trying to get pregnant, my husband and I, when I was 27, and I didn't have Pierce till I was 30. And when I think back to like, if we had first gotten pregnant when we first got married, and then we had so by the time we had Pierce, we had been married for 6 years and together for 10. And if I had my son early in our relationship, and I had a similar experience, I had serious postpartum OCD, and a very high needs baby, I don't know if our relationship would have been as solid getting through that, So
absolutely, nothing puts stress on a relationship like having a baby.
Absolutely.
I mean, if your relationship can survive the newborn period, you're probably pretty solid.
So true. So I am, in a way, like I can look back in hindsight now. I have my children. I'm grateful to have them. Would I have wanted them any sooner in my life? No. I think they came into my life. I was lucky that they came into my life when they came into my life, and I think we're a better family for it. Yeah. So, not that I wish infertility on anybody, because I don't. What about for you, Stephanie? As far as like, what's your experience of parenting a baby? The newborn feedings and the wake ups, and because you with being 28 versus 40, anything age related?
So I also have a little bit of a different perspective, because with my son, his father was not ever involved, except to come and visit every now and then because he thought he was great. But I mean, I was his only, he slept with me, or in the cradle next to me. And so I was for the newborn parent, but oddly, even though with my daughter, I had Jay and I had the help, it was harder for me. It was so much harder for me with her versus with him. And I don't know if it's because I'm older or my life circumstances. I don't know, but for some reason, I kind of feel like it might be because I'm older, because she sleeps with me, and Noah slept with me too, but he was not nearly as demanding. Nora I only nursed him until he was about 8 months old. With her, she's still nursing. She's 2.5. So it's completely different as far as like nighttime and stuff goes. As far as like regular parenting, like during the day and stuff, I don't think it's too different. I think that I might get more, even though Jen was like, I think I'm less. I feel like I get more annoyed with her than I did with Noah. And I don't think it's her fault. I just think it's just, I'm tired. I'm dealing with so much more stuff now than I did when I was 28, that it's just totally different for me versus like being 28 because I feel like I was much more chill with him than I am with her now. Her, I'm like, what are you doing? But maybe it's the boy-girl thing too. Like, I don't know. It might be the boy-girl thing.
So it's funny because when I worked in D, like, when I worked in the city, we had a lot of teenage moms.
Yeah.
And, sometimes people are like, oh, I don't want to take care of it, a whiny kid. But like, I actually really like taking care of the teenage moms because I liked being that role model for them, and I liked being able to support them. And I felt like, I could offer them a lot. But what I also liked is they were really not that anxious. Like,
True.
They were so laid back. Like they just expected it was just all going to work out. And then it's funny, I left that job and started working my Cambridge job, and I had never met so many incredibly intelligent older people on so many psych drugs. Like I just had never.
It's totally true. I miss my teenagers from Brooklyn. Like those were I loved those girls.
They were the best.
They're the best.
When I was in I had a lot of teenagers too when I was in Bennington.
Yeah.
So
and they were always my favorite.
We could build our ideal birthing person would be like the carefreeness of the young, the mental stability of the older.
Yeah.
I wish we could, right? The financials of you're in your 40s.
Yeah, right.
Oh,
so
man.
The take home, I used to hear, I've been doing moms groups or parenting groups of different shapes and sizes over the years. And sometimes I would have like a 40-year-old or a 43-year-old new mom, first baby. And they would be like, well, I don't know if I want to attend that group because all the moms, they're all going to be younger than me. And I'm like, yeah, but having a baby is a great equalizer. So all the stuff you're going through is the same, but how you're handling it may be different because you had a career and now this baby's interrupted, so to speak, quote unquote, your life. And so you've had to really pivot. Whereas someone who's younger, maybe that was just sort of part of their plan and they just had a baby, no big deal. But what you guys are saying is really just highlighting too that it's so individual, because sometimes you're not ready to have a baby until you're 43, and that's the best time for you to have a baby. And other times you're really ready. I remember having some clients who were 21, 22, 23 come into group, and it was awesome when there was a 43-year-old and a 23-year-old in the same room, and they're both talking about how they didn't get much sleep last night and their nipples are a little sore.
And they're all the same.
There's some of it that's all the same, and some of it is, I wish people would stop trying to think that it's all about the age. Like, yes, your health is important. Your age, it comes into factor with it. But sometimes you're having a baby when you're having a baby, and you're going to deal with it how you deal with it, and you're going to get the support you can. And I wish people would stop feeling guilty about it. It's just, it is what it is. And we don't we have to think about it individually for like, who am I with? Who do I have near me? Who am I as a person? How am I going to respond to this? And you're going to respond differently to each individual child as well.
Mm-hmm.
It's true. It's true.
Yeah. I mean, I have, my current practice is really interesting because we have people, our pregnant people are from all over the world because we have a very international population with a lot of graduate students and spouses of graduate students and the like. And so, we see people, with planned pregnancies from their early 20s until their 40s. And, oftentimes it's in terms of mental preparedness for the difficulties of pregnancy, birth, and parenting is often better in the younger than in the older, because you get to a point in life, you've read every book, you've read every study, and you think you know how it's going to be. And if you are kind of a driven career person, you got there because you were able to control your circumstances. And what you don't understand is that this is not a circumstance you can control. And so I find that there's often more mental flexibility in that way in younger first-time parents, maybe than older first-time parents. But I've had a number of patients who've been like marathon runners, and they're like, I can do natural childbirth, I've run a marathon. I'm like, okay, so the difference between running a marathon and having a baby is that running a marathon is all about control. Having a baby is all about letting go of control. Like, you will not give birth until you let go of control, versus a marathon running is all about the training and the controlling and how am I going to get to 26.2 miles. And, it's I think our minds are maybe a bit more pliable and amenable to letting go of control when we're younger than when we're older.
I think that's a really good point. In fact, when I taught childbirth class in upstate New York, nobody ran marathons there. They thought I was weird for bringing hummus to work. And so I used to say labor's like a marathon, because they were like, oh, marathon sounds like something really hard. Okay. And then I started teaching in Cambridge, and I was like, labor's like a marathon. They're like, what marathon? I will run that marathon. I will train for that marathon. And I was like, whoa. It's not like that. You can't stop halfway through and decide to walk. You can't train for exactly how long it's going to be. And, so it's so true. Like, there's that level of, high achieving people. Myself being one of them, type A, high achieving kind of perfectionist, definitely had to let go of a lot of control in order to be a healthy person and a healthy parent and have fun with parenting when I had my first. So it's really funny is my sister, who I'm very close to, is 2 years younger, just had her first baby the same time I had my third. And they're about 10 months old. And she is also, she's a marketing director. She's very driven, type A. And we both had them playing the other day together at a socially distanced, level. And my daughter's like putting rocks and sticks in her mouth and crawling off the blanket. And my sister is like, she's not staying on the blanket. I'm like, Marlena, she's not going to stay on the blanket. But it transported me back to when I had my first, and like I would never have let my oldest son like off that blanket. Like, I just had to let it go. I had to let it all go.
It's so funny that you say that, because I was actually the opposite. So I actually was like a preschool teacher before I had my son, and like I could give a crap less. But I actually care more about what Nora does than what he did, because I'm like, whatever. I'm like, he's gonna do it anyway.
Parenting.
It's so funny, although I think it's more. I think with Nora, it's more. I'm not as worried about it as like maybe Jay is, because she's his first child. So I think I get like freaked out because I'm like, he's gonna get freaked out, even though it really wouldn't bother me. Like, go ahead, eat dirt, I don't care. Like,
is it clean dirt? Okay, it's fine.
It's so funny. It's so funny. It's true.
I'm always trying to get my son to like play in the dirt. He kind of. I feel like in that way, like those kinds of things, like I've always been like, get him dirty, it's gonna build a good healthy microbiome. Like, that's like where I'm at, right? But
me too.
A friend of mine, so what was interesting is when I had my son, there were 3 of us who were pregnant in our practice, plus our office nurse was pregnant, and there was someone else who was pregnant. But anyway, there were a lot of us pregnant at the same time, and all gave birth within like 3 months of each other. But this, our office nurse, one of my colleagues, and myself all gave birth within a week of each other. So we made our own like kind of postpartum support group, which was great. But I remember one day, my colleague was like, "Yeah, so we took the baby to go play in Mount Auburn Cemetery, and I noticed that she was chewing on something."
Oh no.
And I was like, "Oh, she shouldn't be eating anything. Like, we didn't give her any food." And fished out of her mouth
Don't
a
say
dead
it.
baby bird.
Oh,
And I was like, and she was like, I mean, she was okay, but it was just really disgusting. And I was like, yeah, well, she's gonna have a really good immune system.
My kids done similar. I mean, not quite as gross, but just similar grossness. Yeah, I hear you. I hear you.
Parenting is going to challenge you in ways you never imagined, no
Never.
matter your age. I
Yeah.
feel like that's a good, like,
Yeah. My son is fairly fastidious, except for the fact that he absolutely hates taking baths. So
Oh,
before
my son
before
is like
COVID,
that too, and he's 13.
well, before COVID, he would adamantly refuse to take a bath. If we could get him to bathe once a week, it was a win. Like, he's very strong-willed, which is not surprising given who his parents are. But now we make him take a bath like pretty much every night because it calms him down, and this whole like situation is kind of insane, and it's making him insane. So, you know, we've kind of forced the situation. He still kind of refuses to get into the bath, but then once he does, he's like,
You liked it.
you know, yeah. But yeah, but otherwise, like, he doesn't like it when he gets dirty, but he won't take a bath. So I don't know.
after this whole pandemic's over, then you'll have to have him hang out with my boys because they have absolutely no problem getting dirty.
Okay, so we need to get Nora together with them too.
Yeah,
Because
they
she's
can
not
teach
talking.
him the fun of mud. I'm like, look, buddy, it's mud. It's so much fun. He's like, but then I'll be dirty.
Oh, it's so
I
true.
used to make mud pies. I used to love that stuff.
Yep. So one last question for you guys. If someone's thinking of getting pregnant in their 40s, what's your advice? Stephanie, you first.
I would say to, if you're thinking about it, you're not pregnant yet, you're thinking about it, I would say to do as much as you can to be as healthy as you can be. And just try to let things just be the way they're going. As long as it's, not a complicated pregnancy, but just try to let things go the way they're going to go, because I mean, you can't really control it. So just kind of be as healthy as you can be, try as hard as you can do to like exercise and just do what you can to make yourself healthy. That will help your baby be healthy. And just, which is hard for me to say because with my daughter, I was very unhealthy. I didn't eat all the time ever because I was so sick. But, I think that's probably the best thing, and just try to let things go and don't let outside sources dirty your mind. You can do it, and it is healthy and okay as long as you are being safe and you're being followed, and it's just a matter of being healthy and safe and knowing what you're going through.
That's great advice. What about you, Jen? What would you say to anybody who is thinking about getting pregnant or finds themselves pregnant in their 40s? Any advice?
Well, I absolutely agree about, being as healthy as you can in advance, making sure that, and if you do have any health problems, that you get them under control before conceiving, if at all possible. Maybe have a preconception visit with a trusted healthcare provider. Then I would say, pick the hospital you want to give birth at before you pick your care provider if you decide to give birth at a hospital. So pick your place of birth first, then choose a provider, because your chance of having a good experience during your birth has more to do with your place of birth than the person who's going to catch your baby. So if there is a positive culture surrounding birth at a hospital, you're going to have a much better, I don't care how connected you feel to that gynecologist you've been seeing since you were 13 years old. If they deliver at a hospital with a really paternalistic obstetrical culture, you're going to have a terrible experience. If you can say, you know what, I want to have my baby at this hospital because I really for whatever reason, I don't have my baby at this hospital because this is the culture that I want to give birth in, but I'm going to come back. I'll come back to you, for my gynecologic care in a year, but you don't pick the provider, pick the location, because that can make such a big difference in your entire pregnancy, birth, and postpartum experience. And to remember that postpartum period is really now extended to about a year after you've given birth. And so you just have to have the right people behind you because you need to trust them. If someone says, we have a problem here, you need to believe that they have your best interest at heart and your baby's best interest at heart, and are not just doing something because it's more convenient for them.
I could not agree with you.
That's good advice for anybody that's
Absolutely.
pregnant. The
It's
person
true.
that your mom used to see, so you're seeing just because of the person that gives you birth control pills might not be the first person that's going to give you the birth experience or help you achieve the birth experience that you would desire, for sure.
But let me
I would
add to that too, that, I see a lot of people over the years as a childbirth educator even, where you just are like, well, why'd you choose that hospital? Oh, well, I had 3 girlfriends that gave birth there and they thought it was fine. And so they're going to that hospital, or it's the one in my city, so of course I'm going to go to that one, or it's a teaching hospital, so they must be better, or it has a NICU, so just in case anything happens, I want to go there. Their decisions of how to choose that are not based in how the 4 of us would recommend it. So one aspect of how to ask around to figure out which is the better institution, and then after that, which are the providers that might give you what you want for your pregnancy and birth and the kind of attention you need, would be to call around to some birth doulas. If you have people in your life that know labor and delivery nurses, ask them, like, what is the culture at that hospital? What is the culture of the care providers? Are there midwives there? That typically is a helpful thing. Not always, though, because some midwifery programs or midwifery teams within certain hospitals are much more strong-armed and can't do midwifery care the way that some other hospitals might be able to do it.
True.
So, choosing a midwife allows you to choose a doctor. You always get a doctor with a midwife on the team in case you need one, whereas a lot of people don't know that either. But really asking the doulas who visit different hospitals and really have the pulse on what's happening these days in which hospitals. But absolutely, if there's somebody in your life that knows a labor and delivery nurse, then ask them, because they'll.
Oh yeah, for sure.
I agree. I totally agree.
The other thing I would say is, when choosing your place of birth, look at cesarean rates, because even a hospital with a lot of higher risk deliveries, where they care for higher order multiples and stuff like that, you're going to expect them to have a higher C-section rate. But I can tell you that a hospital that, and remember, published C-section rates may actually be significantly lower than actual C-section rates. I worked at a hospital that had about a 20% C-section rate, largely because the volume was so high that you just had to kind of roll them through, and the vaginal birth was kind of the best way to do it. I also worked at a hospital as a travel nurse that had, I don't even know what their published stats was, but when we looked in the delivery book for that current month, the rate was about 70%. And what you can tell in most cases is that high published C-section rates probably mean a more paternalistic model of care, and one with probably a lot of private practices, or with doctors who just aren't willing to wait. You want to look at C-section rates, you want to look at, do they have hospitalist care? In most cases, hospitalist care is actually going to give you a lower risk of having a cesarean than going in to see a solo or group practice, because the hospitalist is there for a 24-hour shift and they're handing off to another hospitalist in 24 hours, and whether or not you give birth on their shift does not matter. Versus if you're in a private practice and that doctor has been on call for 48 hours and they just want to go home and sleep, and they don't want to leave, their failed labor or whatever, for the next person coming on, because that person is not very nice or whatever. And so they're just going to do a C-section at, 5 p.m. to make things easier. And I've seen that too. When I, in New York, I often saw doctors say, my kid's got a soccer game at 5 p.m. If this baby's not delivered by 3, we're going to the OR. Like, it happens. So,
I absolutely experienced that when I worked with private practices.
Yeah,
like
I think
whatnot.
I think that's what happened to me with my son.
mm-hmm.
I really think that. And it was at night, but I knew he wanted to leave. And then he transferred me to some other lady, and she did my C-section because that's what was going to happen. And I had I was completely oblivious to any of the stuff that I know of now,
Yeah.
So I was like, all right.
So
okay.
Another question from what you just said, Jen, I don't know what the stats are on this, is being 40 and having a C-section. I would assume the answer is yes, but I don't know. Is being 40 and having a C-section actually, is there literature that shows that that's a higher risk for that surgery itself, as well as the postpartum healing risks if you're older? Is there any?
Yeah, I don't know for sure about what the literature says. In my experience, being older does put you at higher risk for a C-section.
Mm-hmm.
A lot of that does, I believe, have to do with placental insufficiency. Many women who are in their 40s have C-sections for fetal intolerance of labor, which usually has to do with the placenta. And so I would say it probably does put you at higher risk of a C-section, but it's also not a guarantee. And if you give birth in a hospital with a lower C-section rate, they probably also have more tolerance for fetal heart rate changes, for protracted labor. The hospital that I most recently was delivering babies at, we just had a real, we were like, you're not active until you're 6 centimeters. We kind of tried to stay, we really felt like, vaginal birth in most cases is safer. So, we're going to do everything we can to make that happen. So you saw a much lower cesarean rate. You saw maybe a higher laceration rate because we had more vaginal births and more operative vaginal deliveries as well. But, you really, I really feel like that should be the number one thing that you look at when you're looking at choosing your place of birth. Because if you go to and you can get amazing care. I have seen such fantastic care at the big houses in Boston. But, with a C-section rate of 30%, you're walking into a hospital before you've ever had, before you're even close to giving birth, and you're increasing your risk of walking out with major surgery by 30-something%. And so you just have to kind of figure out what you need. And, some people do feel more comfortable with a NICU. They're like, I want a NICU. Like, I want that reassurance. Well, you're not going to get that at a community hospital. You have to go to a tertiary care center for a NICU, which means that you have to also then be willing to accept the higher C-section risk. And that it kind of goes hand in hand.
Mm-hmm.
Yep.
I agree with all of that. And if anybody's interested in researching C-section rate, you can Google that. Massachusetts cesarean section rate by hospital, and that is public information. So you definitely can do that. So this has been such a wonderful conversation. I think our takeaway points are that having a baby at 40 is much more common than it used to be. So if you've waited to have children until now, or you found yourself pregnant at 40 or 40 plus, you are in good company, including the 2 mamas that we have on our call today. And despite the challenges it can take to conceive, having children in your 40s is definitely a possibility for many people. You'll want to talk to your doctor or your healthcare provider, midwife, whatnot, about your individual risk factors before starting a family at this stage in your life, of course. And Jen had mentioned having a preconception consultation, which I think is great for really anybody planning a pregnancy, to really go over how you get your health in the best condition before welcoming a little tiny baby into it. And know that there are providers out there that are used to taking care of birthing people that are on the older side of the spectrum. And so if the person that you're seeing makes you feel like a black sheep because they don't ever take care of somebody who is in their 40s, that could have consequences for the way they advise you in pregnancy, labor, and birth. And so, seeking out a practice that does not, outwardly call you an elderly pregnant person, which is the medical terminology for a pregnancy over 35, then, probably is to your best advantage. So thank you guys so much for being on this call. This was such an excellent conversation.
Thank you. Awesome.
You want to send us off, Jeanette?
I will. So thank you for sharing. So if you want to find out more about our guests, be sure to check out their websites. You can find Jenn at sharkinfestedh2o.com and Stephanie at Sweet Little Bundles Birth Services on Facebook. And we hope you'll visit babiesincommon.com/videocast or /podcast to listen to past episodes and see what's coming up for future episodes as well. If you have ideas for us, send those in. Please do that. Our next episode is Monday, May 25th at 1:30, and we'll be joined by Justine Leach of Resilient Birth, who will be discussing what we need to have the birth that we want and how to choose a childbirth class based on our personalities as well as the personality and the content of the instructor. We're working on the title still, but very, very interesting conversation that I had with her about being more informed about figuring out what you want and how do you get it prenatally by learning more about what you need personally. So really interesting to go there. So.
I'm very much looking forward to that conversation.
Emotionally, a lot of emotionally, like tapping into what do you need emotionally as a person, and how do you find that in the right childbirth class for you to get the birth that you emotionally want. It's so interesting. Yeah.
So if you've learned anything helpful, even one tiny morsel of helpful information today, don't be stingy. Please text a friend who's either expecting or parenting and tell them all about us. And if you want to laugh your stretch pants off while learning about childbirth, babies, and breastfeeding, please consider taking a live and interactive Zoom class with us at Babies in Common, or know that virtual feeding consultations and weekly feeding groups are also available. And if you follow us on social media, on Facebook or Instagram, we're always posting great articles, videos, and resources to help you rock your birth and thrive as a new parent. Because we are a community for you. After all, we all have babies in common. Yay!